Treating gum disease is important because there is some medical evidence out there that what we call unchecked gum disease, or in the industry called periodontal disease, can actually lead to other medical issues. It can sometimes cause issues with your heart, kidneys. There's even been some research that says unchecked gum disease can actually cause some brain, or perhaps maybe contribute to Alzheimer's and a number of other things. You just gotta think about it like this: if you're walking down the street and one of your, just like some of my patients have gum disease, they'll say that, hey, I just lost a tooth, it didn't even hurt. But a lot of them, if for some reason, we're like, that's not that big of a deal unless maybe it's a front tooth. But can you put it like this: if you're walking down the street and your fingers just started falling off, even without pain, what would you do? You would run straight to the hospital and say, oh my gosh, what is going on? I have to stop this. Well, often with gum disease, with periodontal disease, you're not going to necessarily have any pain. You will start having bone loss, bleeding, start losing teeth. So even if it's not necessarily painful, and even if you say, well, I can still chew, you might want to get that checked on out, because the bacteria that often cause gum disease actually will go throughout your system or the rest of your body. It can end up in other areas like your heart, your brain, etc. It can actually even cause some long-term serious issues. So during gum disease treatment, after the hygienist does a full set of x-rays, we do measurements to get a baseline and see where you're at. What we'll end up doing is, in some cases, we have to do a deep cleaning. We'll gently anesthetize the area. I don't like to say the SHOT word because that makes people nervous, but we'll gently anesthetize the gums, clean with various instruments. And then once the cleaning is done, cleaning is often broken down, we break it down in quadrants, and our model's using 4 quadrants. If you have enough teeth in each quadrant, then often, if that's where the gum disease is, we'll clean those particular areas. And as often what happens is, every patient, just because you have 4 quadrants, you may only need 1 or 2 quadrants to be clean, maybe even just a few teeth, which are fine. But what we'll often do is, once the patient is, everything is done, we'll bring you back for an evaluation appointment. And then if we need to touch up some areas again, we'll do that with our instruments. We also use a laser or 2, other medicaments, to get everything back under control. And once everything is under control and the active disease has stopped, we simply put you back on a maintenance schedule, which could be every 3 to 4 months.
Awesome.